Good morning, guys. Let's do a quick test before we begin here. Testing, testing. 1, 2, 3. Can you hear me? If so, type yes into the chat room for our text so he can see if the sound is going okay. Yes? Okay, perfect. All right. So, guys, first things first is I just want to let you guys know if you're logging in with a nickname, please log out and log back in with your legal first and last name as indicated on your acupuncture license. This is important if you would like to receive CEUs for today's class. If you are entering with just a name, a random nickname, we can't tell who you are. And so as the reminder email said today, we are asking you to enter your email address associated with your eLotus account. And if you don't know what that is, log into your account and take a look. And then also your full name. So again, those are two very important ways for us to identify who you are so that you receive credit for today's class. All right, so if you have any questions, please feel free to send me an email at info@elotus.org, and I'll be happy to help you. Let's get started. Good morning, everyone, and welcome back to part 2 with Jimmy Yin. Today's class is Acupuncture and Herbs for Migraines, Tremors, and Insomnia, part 2, in which Jimmy continues sharing how to produce results with neurological disorders. My name is Donna Chow, and I will be your host and your moderator for today's class. On behalf of eLotus, I'd like to welcome all of you and thank you for choosing Lotus Institute of Integrative Medicine as your CEU provider. We have been hosting educational courses for over 20 years, and we are proud to be your trusted source of premium CEU content. I'd also like to take this time to thank Evergreen Herbs as well and their customers. Because of you, we are able to host special promotional events and freebies throughout the year. So when you choose Evergreen as your herb provider, you're also choosing to invest in the advancement of TCM. So thank you so much for being part of a great collective. Before we begin, I'd like to cover a few housekeeping topics. Today's webinar is from 9 a.m. to 6 p.m. We'll have a 1-hour lunch break from 1 to 2 p.m. And we'll also have some short breaks in between as well. And those we'll let you know when they are and how long. They're usually, they could be 5, 10, or 15 minutes. We'll let you know. All right. And then so what you're seeing on your screen, it really depends on if you're joining us through your browser or you're using the Zoom app. So typically what we're seeing on our side is we have the PowerPoint on the left and the video feed to the right. And the chat room, you can, if you mouse, this is only if you're using the app. If you mouse towards the bottom of your screen, you'll see options for the chat. You can click on that and you can chat with your colleagues who are also attending today's webinar live. Or if the chat is just too much for you, you can just leave it closed too. All right, so this class you also get is recorded, so we will send an email out on Monday when the video recording is ready. It's usually Monday evening, and that way you have a whole month to watch the class again for any parts that you missed or any part that you want to hear again. Okay, so let's get started with today's class. A little introduction on Jimmy. He is a seasoned acupuncturist and herbalist with over 10 years of experience. He started his private practice, Achieve Integrative Health, in 2007 and built it into one of the largest acupuncture clinics in the Austin metro area, where they are focused on quick, effective, and long-lasting results. So let's go ahead and welcome Jimmy. And Jimmy, if you can go ahead and take over the PowerPoint and share your video if you're not up already.
Oh, no, let me share. Hold on. Let's see. So before we get started, who has not, if you can do it in the chat. So there's two areas like Donna was saying. There's an area in the chat that you can chat with Donna. And then when I ask you questions, I'll tell you to put it in the chat. But if you have questions, there's also a Q&A box. You have to be using Zoom. So type your questions. Like people are already asking questions, okay, so which is great. So how many of y'all, if you can type into the chat, how many of y'all did not attend yesterday's webinar? Let me see. There's a few that did not. So for those of you who did attend yesterday's webinar, I may have to repeat a little for the people that did not attend. So bear with me, be patient, and just be understanding so that, I want to make sure everybody gets the information. Not too many. Okay. Not too many didn't attend. So that's great. Because I would like to, go over more stuff if more people did attend yesterday. If you missed yesterday's, you missed a good one. I set the foundation of everything, even for today. So definitely you want to go back and listen to yesterday's presentation. And before we start even further, I got a few of y'all emailed me, and I want to just give a shout out to thank you for emailing me. And some of y'all shared your personal stories, experience with your health conditions, and gave me some more insights in regards to different disorders, different treatments, and so forth. And so I'm always open to learning, especially when it's your personal experience and your personal experience is different from what the research says. Definitely, I put more value in your experience than what research says. So thank you for that. I'm always learning. I don't claim to know everything. I only know based on what I produce. And so I am always learning, and I want to learn from you just as much as you may be learning from me this weekend. And so again, just to set the tone, some of you who were not in yesterday's presentation, some of you are going to really like the way that I present. I know some of y'all told me that you were like on the edge of your chair all the time, which is awesome. And some of you may hate the way that I present. So I'm gonna do me. That's just me. But anything that I say, just bear in mind, there's no intention. My intention is not to offend anybody, and I do not claim to be better than anybody. I'm just sharing my experience. If you like it, great. If you don't, you can get off the webinar. Okay. So we're here in an environment where, especially in this unprecedented time, there's a lot of judgment going around, people judging other people based on like mask, what to wear a mask, should you wear a mask, all this BS stuff. Nobody knows the truth. Everybody is getting information from so-and-so. I heard so-and-so. I heard research from so-and-so. Nobody truly knows. So what I suggest is, let's do less judging of each other's and judge ourselves, change ourselves, correct, focus on ourselves, making ourselves a better person first, and stop judging your fellow practitioner or stop judging your neighbor. So let's do that. Okay. I'm not saying who's right or wrong, but I'm just saying, let's stop the judging. There's just too much judgment going around. So if there's anything that I say that you may think that I'm judging you, call me out. Okay. You can call me out in the chat. I don't care if people publicly call me out, because if you don't call me out, then I don't know that I'm communicating in a way that's kind of portraying to you that I'm judging you. And sometimes I am judging. I'm human, right? So I'm okay with being wrong. So it's okay if you think I'm wrong, let me know. I won't get offended. I want to know. I will do my best not to make you wrong. Every one of you is right, and so. But sometimes, I'm human and I say stupid shit. And so that's the way it is. Okay. All right. So let's move on. Today we're going to talk. So here's all the subspecialties. Okay. Subspecialties: neuromuscular, headaches, sleep, movement disorders, and multiple sclerosis. So I've already gone over neuromuscular and I've gone over headaches. So today we're going to start with sleep disorders. This is a subspecialty. Let me get some water before I choke. Now, this is a subspecialty for neurology. Okay, for those of y'all who don't know about neurology. Then we're going to go over movement disorders. And then the last one is kind of the bonus. It's where I'm going to go over a multiple sclerosis case. I by no means saying I specialize in treating MS, but I just want to share some of my experience. Okay, so sleep. So the three main categories, there's many sleep disorders, okay? So the three main categories of sleep disorders that I have personally produced phenomenal results is teeth grinding, okay? Insomnia and restless leg syndrome. So teeth grinding, for you, scientific people who like the, complex words, it's called bruxism. I didn't know that. Okay, I didn't know that until I was doing this presentation. I just call it teeth grinding. Okay, so we're gonna go over that. Let's get started. So, also a pre-emphasis for those of y'all who were not in yesterday's webinar. So I will talk about the topic through my slides, and then I'll answer questions. Okay, so I'll go back and forth. I'll teeter-totter, and I will answer everybody's question. If I know some of y'all have had emailed me questions, I will answer them. Okay, if I don't answer them now, I will email you back and answer them. So your question, someone else's question is not more important than yours, and yours is not more important than others. All questions are of equal importance, and therefore I will answer all of them. Okay, that's just one of the things that people didn't like about the way I present, because I answer questions. All right, let's go with the definition of insomnia. So insomnia is a sleep disorder that can make it hard to fall asleep, hard to stay asleep, or cause you to wake up too early and not be able to sleep. And you may still feel tired when you wake up. So when I treat specific disorders, the first thing that I do is look up the definition of what that disorder means, okay? What does insomnia mean, right? And so therefore, I know what I'm dealing with to start off with, right? Next, the bruxism, the definition of bruxism, teeth grinding. It's a condition in which you grind, gnash, or clench your teeth, okay? And then the last one is restless leg syndrome. Restless leg syndrome, condition that causes an uncontrollable urge to move your legs. And typically this happens in the evening or nighttime hours when you're sitting or lying down. Moving eases the unpleasant feeling temporarily, right? So restless leg syndrome is not always when you're sleeping, because it says, see, it typically happens in the evening, okay? But it's when you're sitting or lying down. So people can get restless leg syndrome, when they go home at the end of the day and they're like chilling and they're watching TV, then they can get restless leg syndrome. They got to get up and walk, right? And people who have it at nighttime, those are the ones where you're going to see, hey, they need to get up, and they need to get up in the middle of the night and just walk around before their legs calm down, and then they can go back to sleep, right? So I define all three of these because the treatment is exactly the same, okay? That's why I defined it. All right. So the typical causes of sleep disorders that I treat are, number one, lifestyle. It's like sleep hygiene, stress, hormone imbalance, toxins, medication, chemicals, drugs. These can all cause sleep disorders. Food sensitivities, food allergies. People with like, especially, we also treat a lot of thyroid disorders, and a lot of thyroid people who have like Hashimoto's and thyroid disorders, they tend to have quite a bit of food sensitivities, and also people with like gut issues. Excuse me, gut issues, people who have IBS, IBD, people who have Crohn's, diverticulitis, diverticulosis. There's going to be some food sensitivities and food allergies, right? So this definitely can cause them to, have insomnia, right? And some people, number five, weather changes and allergies, right? So weather changes, barometric pressure changes, those can cause insomnia, allergies. If people can't breathe, that's a big problem, right? Okay, so if they can't breathe, they can't sleep, right? And of course, chronic pain, a lot of us deal with chronic pain, and chronic pain, they definitely can keep your body awake, right? Okay, so the initial exam. So the initial exam is, number one, we want to determine the potential root cause. So what the root cause are these causes right here, all right? Which one of these is the potential cause? Because if it's, for example, a chemical that's causing the insomnia, Well, if they can remove the chemical, a lot of times that solves a problem. This doesn't necessarily need a treatment, right? But sometimes maybe they're taking a medication that they can't get off, that they need to stay on. So we need to help counteract the side effect of that medication, right? Or food sensitivity. If they're sensitive to, like, the Hashimoto's patients, they're sensitive to gluten. If they take gluten, if they eat any type of gluten, they may not be able to sleep. So they do have to eliminate gluten completely, right? So that's what I mean by determine the potential root cause. Number two, you got to determine the organ dysfunction. So like I said yesterday, my whole treatment focus is on organ function and finding organ dysfunctions, okay? That is my whole treatment focus. That's how we make decisions on acupuncture, on herbs, on dietary, lifestyle, and so forth, okay? And we also want to eliminate possibilities, right? So those are the ways that I examine a patient. So the way I do diagnostics is my functional pulse diagnosis, okay? And I utilize blood labs a lot. So I highly recommend patients get their blood labs. Now, can we treat them if we don't have their blood labs? Yes, we can. But does the blood labs help us? Yes. The blood labs help us anticipate the prognosis, okay? Anticipate barriers that they may have in order to get the result that they want, right? And we have thermography in our clinic, so we use that for everybody. So it really doesn't matter. So the blood labs, I wrote, they can do hormone testing, they can do allergy testing, CMP, which is comprehensive metabolic panel, CBC, complete blood count. If they have thyroid issues, that you want to do a full thyroid panel, you want to do TSH, free T3, free T4, and maybe if they have Hashimoto's, or they were supposedly someone told them they might have, make sure they've done the TPO antibodies, TG antibodies. If they have food sensitivities, you may do some food allergy testing, or the sensitivity testing. You also may do inflammatory markers like CRP, homocysteine. There's a lot of labs. Okay, and so which labs do you really need? Okay, I like to go to the number one doctor in the world that gives free information. Okay, it's called Dr. Google. Go to Dr. Google. That's where I get majority of my information. You don't need to be taking another seminar to how to read labs. All this information is free on Dr. Google. Okay. I've been to those trainings, functional medicine trainings. I learned more from Dr. Google. Okay. All right. So the prognosis. So medication-induced insomnia, it's very, like I said, it's very hard to overpower the side effect, to make up the side effect of medications. So if we can get an improvement of sleep quality by 50%, that's already significant, okay? But the other causes, there is a possibility of 100% improvement, okay? And so let me ask and go back and get some, remind y'all, when we were looking at prognosis, I put these percentages like 50%, 100%, really none of that matters. So if you can type in the chat, what really matters to the patient? What did I say yesterday for those of y'all who are here? What really matters to the patient? You type in the chat. Yes, results feel better, but what is the results? Yes, Rebecca, quality of, exactly. So nice, Vicky, Seppi, Katie, great. Y'all are all listening. So they all want a better quality of life. Quality of life. They don't want, this is going to sound counterintuitive, they don't really care if they're sleeping good or not. Okay? If they had insomnia, but they still had the quality of life that they want, and let me emphasize this. The quality of life is not defined by us. We do not define what they want as quality of life. Just like I do not define what you define as success. Right? I don't know what the success means to you. right? So how would you, unless I ask you, what is your definition of success? So how will you know your patient's definition of quality of life? You have to ask them, and that goes on during the initial exam. So this is if you're not taking notes, you should be taking this notes right now. The number one question you need to ask during the initial exam is not, oh, how's your sleep? You do need to ask those questions, but that's not the most important. The most important question you need to ask is what do you want to get from our treatments? What is your goal? How do you define your quality of life? Because most of them will start defining it, right? Some people will say, oh, I just want to sleep better. But why do you want to sleep better? Because even if they have insomnia and they were able to do everything in their life that they want to do and love to do, they would not be in your office. Okay. So if you didn't write that down, you better write that down. This one question will determine if the patient will continue with you or not. This is what I call my caring technique. To get patients to continue treatments with you, you need to care about them. Caring about them is understanding from their perspective, not from our perspective. Caring for someone has nothing to do about you or me. It has everything to do about the patient. This may seem like so simplistic and so like ridiculously obvious, but I guarantee you a lot of you aren't doing this. Okay, so you want to get to the definition. What is their definition of quality of life? So what do you think? Let me ask you, if you can put it in the chat. What do you think your patients, what's their definition of quality of life? Why do they want to sleep better? Why do you think they want to sleep better? Put in the chat. Anybody? Why does your patients want to get rid of their insomnia? Why do they want to sleep better? Feel more rested, clear thinking? Yes. So they can do things they enjoy. Exactly, Amy. Exactly, Mary Beth. Great. Yes. So they can the number one thing is they can do whatever they want, whenever they want. That's the reason why they want to sleep better. Right? So the symptoms is insomnia. The symptoms is fatigue. The symptoms is brain fog, right? They want to be better at their job. They want to move up, their in their company, right? But in order to do that, they need to be, have the mental acuity, right? So these things are the things that we need to focus on, okay? All right, let me answer a couple of questions, okay? The book Enzyme Factor mentioned to drink Kangen water. Oh, Quinlil, you already read it. Great job. The alkaline water. Do you have such a machine to make this type of water at home or in your clinic? No, I don't have a Kangen machine. You can just go. They sell alkaline water everywhere. Can you speak today to Gail Darren? Can you speak today to treating blood pressure with headaches when the patient is not on blood pressure meds? That was a topic of yesterday. So Gail, can you email me that? And then I can respond. Quinlil asked, there are so many anti-inflammatory diets out there on the web. What do you recommend in your clinic to your patients? Besides the vegetable base, would you please be more specific? So Quinlil, if you read that enzyme factor, that tells you exactly what to do for an anti-inflammatory diet. And so I base that I would say I follow that at least 95%. Jeanette Morris, which food sensitivity test do you use? Great question. So when I was talking about this food sensitivity back here, right? Where was that food sensitivity? So food sensitivity is back here. I have done all of the, I've done ALCAT, ALATEST. Those are the two most popular ones. There's some other food sensitivity tests. What I would tell you is don't do any of them. one of my mentors, what he did was he tested the consistency of these labs, and these labs are not really consistent. So what he did was he drew blood. He's a nurse practitioner. He drew his own blood. He put it into 2 different vials, and he put it in 2 different vials, and then he labeled them with 2 different names. Okay, so his own blood, 2 different vials, 2 different names. He sent them to all of these food sensitivity test labs, right? And the report that he got back were inconsistent. So those food sensitivity tests are not accurate, and they're freaking expensive. Like it will cost a patient like $500 just to find out. Okay, so so the next question may be, how do we find out what they're sensitive to, right? The gold standard for food sensitivity is just doing an elimination diet. And you can go onto Dr. Google on how to do this, okay? Basically it's just elimination diet. You remove and you strip everything down you remove all of the common the inflammatory foods like eggs, soy, peanuts, dairy. Oh, what else? What is those? Nightshades. I'm missing something. Gluten. But anyways, there's like 8 inflammation, 8 type of inflammatory, right? So you remove the common inflammatory foods and you strip everything away. And I would say you would start off with like a vegetarian, but with no nightshades. You want to make sure, most vegetables are pretty good. I mean, there's not that much sensitivity to it. And then you do that and you'll have a baseline. And then you add one food back in, right? And when you add the food back in, you want to eat that food like 3 times a day for 3 days straight. Does it have to be 3 days straight? No, it doesn't. Okay. If they're sensitive to it, they will have an immediate reaction. So the theory behind it, okay, the theory behind it is that when you add a food back into the diet, you want to overload your system with, not overload, but you want to put a lot of that food into your system to create, if you are allergic to it, you will have a noticeable allergic reaction. Okay, so that's an elimination diet that I would do. Can you write your email address on the board? Yeah, so it's Acupuncture Wealth, Acupuncture Wealth at gmail.com. Okay, acupuncturewealth@gmail.com. That's my email address. I'll leave it on there while I answer some more questions. Vicky Chung, how should you treat torso tremors upon walking? Was diagnosed with restless leg, but the tremors are in the torso. We'll go through that, and we'll go through some of it in Vicky when I talk about tremors today. Also, please address the focal dystonia of the index finger that a banjo player has indefinite duration of function of the finger while playing and had to change instruments that didn't require picking. Yeah, we can go over that when I go over dystonia. Okay, that's all the questions. All right, let's move on. Let's see. Where are we at? Treatment protocol. Okay, treatment protocol. So sleep symptoms that are constant. Okay. Constant, then your rate of response is going to be 3 treatments within 7 days, right? The expected result is sleep quality, sleep duration, consistency improved. Why am I having, this should not be here. This should not be here. Less waking up episodes. Okay. So this, if y'all, from those of y'all who were here yesterday, are y'all seeing a pattern, right? If the symptom, so you can really boil down my system is so simple. Let me get my blackboard. So if the symptom is constant, this is how I do my treatment protocols. So you see, remember, one system. For those of y'all who were not here yesterday, I use one system to treat every single disorder in my clinic. It makes my life easier. It makes my clinic's life, my associates' life easier, and we still get great results. So that's my whole system. Okay. So when I'm trying to determine a treatment protocol for patients, it doesn't matter what they're coming in for. It matters if their symptom is constant or intermittent. Intermittent. Okay, so there's only two categories. Is that simple enough? Okay, and so first one, if the symptom is constant, then I usually do 3 treatments. 3 treatments within 1 week to determine if acupuncture is going to help them and determine their rate of response to acupuncture. Okay, if it's intermittent, I usually use 6 treatments. But for those of y'all who may, be still trying to, implement whether it's my QRA or whatever acupuncture technique you use, if it's constant, I'd recommend you do 6 treatments just to give you some time. 6 treatments. This is 3 treatments per week for 2 weeks. And the intermittent, you can probably do 6 to 12 treatments, right? 3 treatments per week for 4 weeks. But if you're confident in your ability to produce results, I would not extend. I usually, when I first started off in 2007, I used TCM acupuncture. So I was using 12 treatments. Okay. I wasn't getting the great results that I'm getting now. But now, I usually just use 3 treatments. The 6 treatments, intermittent, the reason why you do that, because they don't have insomnia every single day. So how are you going to gauge? The number one question people are going to ask is, how are you going to know it's working, right? So you need to give yourself some time to show improvement in here, sleep quality. Do they have a deeper sleep? Are they waking up with less brain fog? Are they waking up with more energy? Are they sleeping? Maybe they're only able to sleep 2 hours at a time and then they wake up. Are they able to sleep 3 hours straight, 4 hours straight, right, before they wake up? And also, if they're waking up 5-6 times a night, are they now waking up just 1 time, right? So the consistency also, is it every night? Are they sleeping out of the 7 days? How many days are they sleeping? They have a good night's sleep, right? So these are some of the questions also that you should be asking during the initial exam, because you need to have a baseline. You need to know where they're starting so that you can measure improvement. Okay. So these questions here, right? They don't really determine what I do for acupuncture and herbs. These are purely for the patient, to let the patient know that they are progressing. Okay. But you have to ask them. You have to have this data. Otherwise, what are you going to say to the patient when they say, how do you know I'm improving? I still have insomnia, right? Okay, so once you get past the rate of response phase, then you're going to go to the monthly treatment phase. And I usually continue twice a week for 4 weeks. And then after 1 month, at least 50% improvement. If those of y'all who have been here yesterday, these are the same things, right? The same protocols, right? Remember, simple. I like to keep things simple, okay? Oops. Hey, it's not, there you go. All right. Okay. Sleep symptoms that are episodic, so intermittent. The rate of response, like I said, 6 treatments within 14 days to know if you can help. I don't know why I had TMJ here. But sleep quality, duration, consistency, it's all the same. Monthly treatment plan, twice a week for 4 weeks. And after 1 month, it should be at least 50%. And then the way that you continue, so let me go. Treatment plan outline. Okay. Step 1 is rate of response plan. This is to see if we can help them. If we can, then the first care plan that I give them is first care plan. I call it CP, is 1 month. Okay. I do 1 month because for my associates, right? But I won't get too much into that. I'll just tell you what I'm doing. Okay. So I do it month. So we do a care plan or a treatment plan. Don't use the word packages. Okay. I know a lot of y'all like to use the word package. Use the word care plan or treatment plan. Package is like massage. It's like a discount thing. It's like it's just the connotation of the word package in the medical community is not related to customized, is not equivalent to customized treatment plans. Okay, and so I highly recommend you use the word care plans or treatment plans. Right. So after the first month, we re-examine them and then we see where they are. How close are they to 100%? And remember, 100% is determined by them. It's not determined, it's not defined by you. So you want to ask them, what does 100% mean to you? What does that look like? And then after every month, I ask them, so how close are you to that? If y'all aren't writing this down and taking notes, I'm like throwing nuggets already. And it's only how many minutes? 37 minutes into the webinar, okay? I'll be throwing nuggets like this left and right the whole day. So if you're trying to like double task, like you're just kind of listening and doing something else, you're going to miss all of this, okay? So after the first month, I'll ask them how close they are to 100%. So after the first month, I want it to be at least 50%. So let's say they come back and say, oh, I'm about 60%. Then I'll ask them, okay, are you happy with that? Right? Some people, surprisingly, may be happy. So then they're good. They're good to go, okay? Why? It's not for us to say, oh, no, 60% ain't good enough. But if it's good enough for them, what does it matter what we say, right? Remember, it's not about us, it's about the patient, okay? But most people are not happy with 60%, okay? So the most common response is they're going to say, no, of course I'm not happy. I want to be at 100%, right? And so then if they're only at 60%, then the second month, okay, the second month, which is the second care plan that I present them, will pretty much be the same thing, okay? It'll be the same thing as the first month. So it's twice a week for 4 weeks. What I'm looking for is a treatment plateau. Like for 2 weeks straight, they just are not getting any better, okay? When we hit that plateau, I will be the first to tell the patient, okay? I will be the first to tell the patient we have plateaued. And this most likely is the maximum benefit we can help you achieve, okay? And at that point, then I will start the retraining phase of their treatments, which is I start weaning them down. So then I'll have them come once a week for 4 weeks. Again, there's no right or wrong method. This is just my way, okay? You can do whatever way you want. My clinic, our focus is on corrective care, which means once we help the patients get what they want, I take it a further step. I want to make sure it doesn't come back, okay? So that's part 2 of my treatment phase. Phase 2 of my treatments is I want to make sure their insomnia does not come back. So when I do that, the way that I do that is I start weaning them off the treatments. So I'll go once a week for 4 weeks, and then once every other week for 8 weeks, and then once, running out of space, once per month indefinitely, if that's what they want. I don't make the decision for them, they make the decision, okay? All of these treatment plans that I'm going over, none of it is me forcing the patients to do anything. I know some of y'all don't like selling prepaid plans. I sell majority of our patients are prepaid. I know a lot of y'all don't like doing that. I don't force my patients to prepay anything. They can always pay as they go. I always give them the option. In my humble opinion, it is not our job, and it is not our job to determine their finances. It is not our job to determine if they can or cannot afford treatments. That's not our job. Our job as an acupuncturist, number one, is to give them options. The decision is always the patient's, at least in my clinic. I do not hard sell them. I just say, here's your options. And I explain the options. And then I ask them, so which option would you like to choose? That's how I close patients, okay? And so, but that's just a side note. All right, let's move on. So acupuncture treatments. All right, let me see if you have any questions. Oh, you don't have any questions. Okay, then let's move on. Points. So again, there are no magical points for insomnia. I typically use about 30 needles per patient, okay? So how do we treat insomnia? Like with yesterday's neurological conditions, we have areas where we know which areas to image, right? It's like, where do you image? We know Bell's palsy, you image the face. Trigeminal neuralgia, you image the face. With neuropathy, you image the hands and feet. So who knows? I want you to type into the chat, who knows what the hell do you image for insomnia? What do you image? Because I still image. Who knows? Type. Dong Fong, you got it. You got it. Organ. So which organs? Dong Fong, Win. Which organ do you, Simon? Heart is one of them. What else? Liver and heart? Yep. Yep. Yeah. Kidney? Lan An? Yep. Y'all got it. I don't need to teach the course anymore. Y'all already got it. Okay. You see how easy this is? Acupuncture is so easy. We just make it too complicated, okay? And we think it has to be complicated. If it's a complex case, it has to be a complex disorder. It has to be complicated. Maybe, I don't know, but not for me, not for my clinic. It doesn't have to be complicated. Again, I'm not, same thing like I do to my patients. You don't have to do anything that I say. I'm just giving you another option. And if you like your life to be simple, I don't like my life to be complicated. I like it to be simple. The more simple my systems are, my treatment systems are, my clinic systems are, the more people I can help. The more complicated it is, the less people I can help. The more simple my system is, the more acupuncturists like you can learn it and duplicate it. I want duplication. I don't want to be the best acupuncturist in the world. That is not my agenda. My agenda is to spread whatever I'm doing and help other acupuncturists so you can help more people, and together we can help more people. That is my purpose. It's not to say, oh, hey, Jimmy's a shit. You should all study with him. Only he knows how to do neurology. No. I'm not the only person that does it, but I want to be the person that's spreading the most simple system so that you can go home and duplicate it wherever you are in the world. Okay, so let's do this. All right, so if we're gonna, everybody's right. We've got your liver, we've got your heart, we've got your kidney, right? So even if you don't know how to do pulse diagnosis, you could treat somebody with acupuncture and help them with their insomnia, right? This is like TCM 101, liver, heart, kidney, right? And so just by imaging, imaging these areas, we can already help them, right? So this point selection basically addresses all these three, basically images all of these three organs, okay? So let me get my little mannequin. Let me stop sharing this. Well, you're gonna have to need the points. Well, I'll just tell them. You'll come back to it. You can look at it later. Okay, so the first points that I wrote is left side, Sanjiao 5 to Sanjiao 7. Okay, so let's look at where is Sanjiao 5 to Sanjiao 7. Sanjiao 5 is right here to Sanjiao. Oh, where's 7? Yeah, 5 to 7. It's only here. It's right here. Okay, Sanjiao 5 to Sanjiao 7. Okay, so it's this area right here. So why would I want to do this area? This is just rough. It is not. It is the point that the area that I actually poke is not exactly Sanjiao 5 to Sanjiao 7. I'm just giving you a reference point. Usually I just go. I will do Sanjiao just up the Sanjiao nerve, like 5 needles, right? Bam, 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 right there, right? 5 needles right there. And so why here? Because most of the time I only have access from elbow down, okay? So imaging with my QRA, where we're imaging, so my QRA, remember, is no points. I'm giving you points just as a reference. I do not stick Sanjiao 5 to Sanjiao 7. I'm just telling you, I image, that area is where I stick the needle, somewhere near there, okay? So if you look at this arm, okay, well, first thing, where is the liver? Where is the heart? Where is the kidney? So heart, the actual physical organ heart, okay? So the heart's right here. So if we draw a line, right? We draw a line, that's how we find the point. So we draw a line, it comes to here, right here. This is this area, it's like on the top of the shoulder. So if I stick points right here, I'll just stick 5 needles all around here in this, around this line, because it's the same level as the heart, okay? Just they're all around here, probably just a little below at the insertion of the deltoid, okay? I'll stick all needles like bam, 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 right there, okay? All of these can move blood to the heart, okay? But remember, if we reverse image, right? So let me use this as, so my heart, let's say, is right here. I'm drawing a line. So you would stick a needle. If you were to treat my heart, you would stick a needle like right here. 3 to 5 needles right here, right? In this area. And that will treat my heart because it's the same level as my heart, okay? But then if I reverse image, like this, right? If I draw a line, my heart is near my wrist, right? So that's where I got the Sanjiao 5, Sanjiao 7, okay? And then I have large intestine 6 through 11. So 6 through 11, large intestine 6 through 11. Basically, it's this, my whole arm here to here, right? It covers, how many organs does it cover? Let me see if I can get this. No, I'll use my hand. Hand's better. So how many organs can I cover? If it's, oh, this is better. So how many organs can I cover, right? I can cover basically all of them. If I use my forearm, my whole arm from here to here, or actually even from my hands, but let's just go from wrist to here. I use this section to image this, the whole torso, right? So my wrist would be near the chest. You see my wrist right here. And then my elbow would be near down here in the pelvic, right? So if I just throw any needles around my forearm area, I will get the liver, I will get the kidney, and I'll get the heart, okay? Does that make sense? Am I confusing y'all? Type in the chat. Does that make sense? Okay, most people are saying yes. Okay, good. So that's how I choose my points. It's just, I mean, not even points. That's where I stick the needles, right? So that's where I got large intestine 11, large intestine 6, 11, 6, and then in the legs, it's the same thing. So if this was like my forearm, okay, the mirror imaging is a little confusing. Yeah, so you just have to draw it out. But it's, if you look at from here to here, from here to here, this is your knee, this is your ankle. So we're just using like the tibia bone, okay? And we're imaging my whole body, my trunk, from here to here to here is here to here, okay? So here to here is here to here. So if my liver is right here, then the liver, the nerves that you're going to stimulate are going to be right here. If my kidneys are back here, then if I stick points down here, they will hit my kidney. If my heart is right here, it's a little higher. So if I stick points up here, it will hit my heart, okay? Remember, I do not use points. I do not use meridians. Just throw needles. Just needle. When in doubt, stick a needle, okay? So let's go back. Most people who struggle with this are like, man, it can't be that easy. It's got to be more complicated. No, it doesn't, okay? It does not have to be more complicated. You can make your life more complicated, but it doesn't have to be that more complicated. All right, let me go back to the slides. Hey, where's my mirroring? Here we go, share. Hold on, computer freeze. Don't freeze. There you go. Okay. So next, that's why I have the points liver 3 through 8 and spleen 6 through 9. Okay, because remember, just like the lower leg right here, spleen 6 through 9. This will cover really it not only covers the liver, the heart, the kidney, it covers every single organ. Like, where are your organs? Your organs are in your abdomen, right? And so just by doing this right here, spleen 6 through 9, liver 3 through 8, and you add on kidney 7 through 10, these are the most common points that I use for every single disorder in my clinic, okay? Just by doing, like, if you are ever in doubt of which points to use, just do this combo right here, bilateral, you'll treat everything. It doesn't matter, imaging, reverse imaging, upside down imaging, my imaging, tan imaging, I don't know, whoever's imaging, it doesn't matter. If you just do these 3 combinations, you will hit everything. Then you'd be like, man, that's not Chinese medicine. That's another complaint that I get. I ain't Chinese medicine. Producing results is Chinese medicine, isn't it? Okay. All right. Number 3, I do yin tang, do 24, do 20. So everybody knows yin tang, calms the mind, right? And so, so that's one of the reasons that I do it, okay? But it is also another imaging. But though, let me talk about the head image, right? So the head is the same thing. If you imagine an upside down body, let me see if I can draw. Let's see. This looks like a turtle. Okay, these are eyes, okay? These are eyes. This is the hairline. So if you imagine the torso, I mean, there's different ways of imaging the head, right? You could image the head where the person's body is like this, and that's the image on the scalp. So if you're trying to get the organs, which are right here, right? Then that's around Do 20. Roughly, okay? But then, let's say, let me get another turtle. These are ears. You could also image where, if you imagine, let's see, do I have the right color? Okay, good. The whole torso of the human body is there. Their head is actually where Intang is, and they're like this. So then the torso could be around here. So that's where I do 24. Really, you can do 24 to do 20. Okay. It doesn't matter. It doesn't matter if it's do 24 or do 20. Just throw needles along that area. It's the area that matters the most. Okay. Any questions about that? About the scalp one? You can type it in the chat so I can see it quickly. Nope. Okay. So let me answer some questions. Why? Oh, hold on. Let me go back up. Joyce Sonata, do you offer a better price for prepay or prompt pay? Yes, great question. Yes, I do. Lance Westerndarp. So is Mira reverse imaging always from elbow down to wrist or knee down to feet? No, not necessarily. You can image anywhere, Lance. The only reason why I say elbow down is just because I don't have my patients undress. They're in their whatever clothing, and I just have them roll up their sleeves and roll up their pants. So the only reason why I'm telling you that I'm needling from knee down to elbow down, it's not because that's the points I want to use. I mean, that's not the points that's my first choice. It's because that's what's available, like what's available for me to needle. I don't needle through clothes. So if they can't roll their shirt past their elbow, then I'm not going to needle their upper arm. Okay. Katie Starr. So when you needle across the front of the lower leg, you go from the anterior medial to lateral, not on the back, unless you imaged only on the back. So either front or back. So when you needle across the front of the lower leg, you go from anterior medial to lateral. Great question. No, I don't go like this. I go like this, still transverse. Okay. So more medial, anterior medial to posterior lateral in that direction, I would say. Okay. Mario Yu, why left on arm and bilateral on leg? Great question. So left, you can use both. I don't, well, okay, so you can use both. You can use both. I always leave one arm open because I don't want the patient to feel pinned down. And so they have one arm that they can, wave or push the call button or whatever they want to do, play on their phone or whatever. So I only choose one arm at a time when I do the treatments. Okay. You could do the left. I mean, you could do the right also. I choose left first because the liver, where is their liver? Their liver is on the right side of their body. So I always try to go with contralateral first. So if the organ is on the right side, I will needle their contralateral side first. Okay. The heart is kind of the center and to the left. So if you want to really target the heart, then I would needle the right arm. Okay. Joyce Sonata, I cannot see anyone's questions. Oh, you can't? Well, that's why I'm reading them. I'm reading the questions, okay? Kelly Rose, insomnia due to a blocked nose from allergies and swollen turbinates, adenoids, tonsils in a teenager. Yes, that's a common cause. with people who have allergies, right? So if that's the cause of the allergy, so remember, you always have to, let me see, you have to find the cause. Where's my treatment? See, that's why I say you have to determine the potential root cause first. So if their insomnia is due to the sinuses, okay, the swollen turbinates, adenoids, and tonsils, you got to decrease those. Otherwise, they won't be able to breathe, and therefore they're not going to be able to sleep, right? So you want to image the sinuses. The sinuses, okay, are basically the nose and eye and cheek level, right? So remember our elbow, see my elbow? Let me get out of it so you can see it. So my elbow, here's my elbow, is in line with my eyes and my nose, right? So this, actually your sinuses go like this also, the frontal sinuses, right? So you have about this area, maxillary sinus right here, sphenoid and ethmoid sinuses back down here, deep in here. So you have about like this area, you have this area to cover. You have this area to cover all the sinuses, right? So this area, if my elbow is my eyes and I need to cover this area, so forearm will cover the top. My upper arm will cover the bottom. So to make it very simple, Kelly, just needle the whole damn arm, okay? 20 needles all down the arm. You'll get everything, okay? Don't be stingy with needles, okay? They don't cost that much. We're very lucky. Needles are very cheap. Okay, let's see. Palpate, Benjamin Dyroff. Sorry if I'm butchering your name, okay? That's just my ignorance. Palpate for tender on scalp. I don't palpate anything. I used to do it when I first learned with Richard Tan, but I don't palpate anything anymore. It takes too much time. Just put needles. If you think it's the right area, put some needles and ask the patient, okay? Now, insomnia is a little different. You can't say, oh, hey, sleep, okay? I wish we could. That would be awesome. Insomnia, you do the treatments and then you have to wait. I hate that. I want instant results, okay? So insomnia, I can't get instant results. Insomnia, I have to wait for them to go home and sleep and then report back, okay? So that's the only downside to insomnia, right? But for the Kelly Rose, for the allergies, you can feel it. The patient will feel like instantly shrink. They'll like to have them take a deep breath. Take a deep breath before you stick the needles, so you know that you created the result. Take a deep breath, a few deep breaths before you put the needles in. Put the needles in. Put like I would say like 5 needles along the large intestine nerve, 5 needles along the lung nerve, and then say breathe. And this usually will do it. They'll be like, oh, wow, oh, I can breathe. Okay. And then if that's the case, then put, 10 more on the upper arm, like in between the needles. Okay. Like in between large intestine and lungs. Remember, there's no meridians. I'm not doing points. I'm not doing meridians. If I just start off doing large intestine, just because it's the middle of the arm, and then go into the lung. And if you did those 10 needles, like you did bam, 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 5 needles in the lung, and they can suddenly breathe so much better, I would put 5 more needles in between the large intestine nerve and the lung nerve. So I would go here, 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 and then ask them again, oh, wow, I'm completely clear. Bam, you're good to go, okay? So hopefully that helps. Needle, Benjamin asked, needle direction with flow of channel, nerve, or perpendicular. It doesn't matter, Benjamin, it does not matter which direction the needle is. The most important part of my acupuncture style is that the needle touch the nerve, because what I want to happen is the needle to send a stimulus, a message to the brain, to tell the brain, hey, you're supposed to be vasodilating the blood vessels to the turbinates, okay, to this part of the area, to this part of the sinuses, right? That is my intention. That is what I do with acupuncture, okay? Katie Starr, I did not mean the direction of insertion. I meant the order of placing the needles from medial to lateral on the anterior side and not using the back of the body. The order, Katie, I don't do any order. I just choose a spot. I just really, the way I choose the order of that is where so my patients are laying in a recliner, right? And I'm sitting on a little stool that I'm rolling around. So I just roll up to them. And depending on which side that I roll up to them, if I roll up to them on the left side, then I'll start on the left side. If I roll them on the right side, I'll start on the right side. There's no specific order. And then I'll just do one side first and then go on to another side. Let me know if I'm still not interpreting your question correctly, okay? Treatments in chairs with clothes, so no cups. Rebecca Bright asked. I do not use cupping at all. I used to. It's too much of a pain in the ass, and the results aren't lasting, in my clinic at least. Kelly Rose, what is the youngest age you would do needles on a person? I would stick a needle on anybody. It's not more of what I would do. It's more of the patient will let me do it. Just like my wife, she ain't gonna let me stick a needle on the bottom of her foot, okay? So the youngest patient that has let me stick a needle in them is 8 years old, right? All right, Vignesh, any advice on treating sleep apnea? Great question. There's a reason why I didn't put sleep apnea in here, because sleep apnea is basically, as far as my experience, I've treated a few, okay? I just haven't treated hundreds of them. And so therefore, I'm not going to say, okay, I'm great at it. So I've seen two causes. One is allergy-based, okay, sinuses based. And the other one is structural based. The palate and the upper palate in the back actually collapse. If it's a structural base, when I do acupuncture, it doesn't help. What they can do, usually what I recommend is they go to their dentist, or they can get it online. There's a little insert in their mouth appliance that they can put in their mouth at night when they sleep, and it literally physically lifts the palate, and that usually solves the problem. I don't tell people whether to do a CPAP or not a CPAP, because that's not within my scope of practice. But my experience is that people with CPAPs, if it helps them for maybe 1 or 2 years. And then after that, their sleep quality still goes back. They technically don't have sleep apnea, so to speak, but it's just forcing oxygen into their lungs. And so they actually get worse. Eventually their sleep, they'll still wake up tired. They'll still wake up brain fog. It comes back, okay? Because it makes the body lazy. The allergy part, yeah, if you can solve the allergy, then you will solve the sleep apnea, okay? All right, let me continue on. Great questions, guys. I thought y'all were asleep. Yesterday, I had tons of questions. Yesterday, we had like 300 questions. I was like running behind on questions, answering them. Okay. Oh, did I skip? Okay, so, I need to share my screen. Y'all don't see what I'm doing. Share my screen. Oh, not this one. Perfect. Okay, notes. Patients should feel relaxed after the treatment. Since we don't get instant results, we can't observe instant results with insomnia. So, except for the allergy part, right? They at least need to be, relaxed during their treatment, right? And like I said, you won't know until they come back the next day. Okay. Herbs. So what do we do with herbs? Okay, let me grab some water. Again, there's no magical herbs. Every herb works. So you don't need to ask me. I'm going to answer any person who has a question about herbs. Does this so-and-so herb work? Does this work? Does this formula work? Here's my universal answer. Yes. Okay. So you don't need to type that in the Q&A, because yes, it works. Okay. Every herb works. It's not about the herbs. It's about the organ dysfunction. Which organ is dysfunctioning? That's the key. It's not about the herbs. Okay. And you treat the pulse. I treat the pulse. That's how I prescribe herbs. I do not prescribe herbs based off of symptoms. Okay. Single herbs, you can read through these formulas. These are common formulas that you can go through. But let's talk about, so we talked about acupuncture. Acupuncture, you don't even really need to know which organs are dysfunctioning, and you can already treat them. Remember? Because I said right here, you just treat these 3 organs, and most likely you will get results. A high possibility, right? So some of you don't do herbs, because I know I'm coaching a few acupuncturists in the UK, and I think y'all aren't required to do herbs, and so they don't do herbs. And so I'm like, doesn't matter. You can treat insomnia with just acupuncture, okay? I've treated insomnia with just acupuncture, just herbs, and the combination of both. The combination of both is always better, but sometimes people don't want to take herbs, so I've done it just with acupuncture by itself. I've done it with just herbs. Some people don't want acupuncture, so we do herbs, okay? So it can be done, I'm letting you know. All right, so when we look at the pulse, so if we're trying to use herbs, then we have to, in my system, I need to identify which organ is dysfunctioning, right? And so let's take a look at what organ, let's see. Let me write the Chinese first so I can get it all in. Okay. Can everybody read Chinese? Do I need to write the English? Okay. Nobody's saying no, so y'all can all read Chinese? Okay. Oh, okay. One person said no. 木火 fire heart. No. Hold on 1 second. Liver, 火 heart, 土 spleen, 精 lung, 水 kidney. Okay, wood, fire, earth, metal, 5-element theory. Okay. All right. So, then we have this. Here, 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 here. Okay. So we know the main organ that helps with sleep, that regulates sleep based on TCM Foundation, is the heart, right? So what organs could affect the heart function? Because whatever organ can affect the heart function can affect the sleep. Let me draw this a little more clear so it's not so. There you go. So any organ that can affect the heart can affect sleep, right? So we know liver right here generates, what's that, a mother-son combination, right? So the liver, if it's overacting, it will affect the heart, right? If it's too excess. And on the flip side, the mother heart of heart and spleen. So this is why digestion can affect the heart too, right? Therefore, digestion can help affect sleep too, right? And we know that the kidney right here, what is this called? I think it's called controlling. It controls, not controlling. What is the word? The kidney does what to the heart? What is that word called? What is, I forgot the word. But basically the kidney affects the heart. Over control, yeah, control, right? So if the kidney over controls the heart, that will affect the sleep, right? And the heart controls the lungs. But if the lungs overact and gives the heart a hard time, then the heart can't control the lungs, right? My point of showing you all this is hopefully it can, yeah, So my point of showing all this is to show you that every single organ in your body affects your sleep. That was my whole point. Okay. Exactly, Rebecca. Exactly. So that was my whole point. So therefore, we look at the pulse. That's the reason why we look at the pulse, and we don't just say, hey, we only look at these 3 organs, right? Because every organ can affect the sleep. So let's look at like these. Let me give you an example. Oops. So if we have a pulse, let's say this is the left side, okay? So let's say okay, so we're looking at this pulse first. This is the left guan pulse. So we discussed yesterday that the pulse, the home, what is the home of this pulse right here? Y'all aren't seeing my arrow. Hold on. Let me see. Let me share it again. It's probably lost some connection. The hurricane, whatever, is hitting Texas. So it's raining over here. Okay, there's my arrow. Oh, it went away. Dude, where's my... Well, what is the home of this? There you go. Of the left guan. Who can tell me the home of the left guan? Middle. Jeff, Thomas, Benjamin. Yes. So this pulse right here is above its home. Okay. So what does that mean? Who remembers from yesterday? If it's above its home, what does that mean? What is a TCM diagnosis? Katie, start. Yep, heat excess. Very good, Katie. You see, my system is so easy to learn. You don't even have to. It's on. It's not empty fire. It's above its home. I would just say it's the diagnosis is liver fire or liver heat. Liver heat or fire. Let's say liver heat. Okay. So what formulas, if the patient with insomnia, doesn't matter if they have restless legs or grinding or just other causes of insomnia, if they were presenting with this liver heat pulse, what formula would you use? Yep. Joyce, Katie, yeah, Seppi, exactly. Yeah, Christina, Jeff, perfect. See, y'all already got the information. Y'all already know. Y'all have the knowledge, right? I'm just helping you use a more simple diagnostic system to use your knowledge. You all have all the knowledge you need in Chinese medicine, believe it or not. Okay, you have all the information you need. You just need to know how to organize it. And like I said yesterday, the number one thing that I'm hoping to get to you is to relay to you is how to make a decision. Okay, so you have all the knowledge. Okay, so let's move on to the next one. Well, my thing would not freeze up. Oh shoot, let me redraw it. No worries. Okay, so the first one, what did I do here? Oh, let me do here. Let me just do this. Okay, this is the left arm. So we already said this one was liver fire, and y'all listed all the great formulas. All of them work. I would put them all together. Okay, I would put them all together. So the 柴胡加龙骨牡蛎汤. So 柴胡加龙骨牡蛎汤 plus 加味逍遥散 plus 龙胆泻肝汤. Add all of these together, 100%, and that will be your formula. Okay, I'm going to add another one here. Okay, we'll talk about that later. Let's talk about this one first. So this is the left shi. So what is the TCM diagnosis for that? Kidney deficiency, Dongfeng, exactly. Perfect. So what formula would you use for kidney deficiency? What formula would you use for kidney deficiency? 八位 or 六位? Yep. 八位六位. Yep. 六位. Yep. Yes, you can use 天王补心丹. You can use that too. I'll just stick with these two. 八味六味地黄丸. There's also 金桂肾气丸. Okay. So if this pulse was the only abnormality, you would use these three 100%. And that would be your formula. Okay. Okay. So last, let's look at this one, this pulse. What is that diagnosis? The left twin. It could be heart blood deficiency. Yep. There's left side. Left side. Eric is not excess. Jeff, it's the left side, left twin, not the right twin. Left twin. Okay, so y'all are a little confused about this. Where is the home for the left twin? Let's start with that. Where is the home for the pulse of the left twin? Superficial, Christina, exactly. So the home, so when it's below its home, I don't think I taught this yesterday, so I'll teach you today. So when it's below its home, it means dampness or blood stasis, or stasis, not blood stasis. It could be chi or blood stasis. So when it's below the home, it means dampness or stasis. So this diagnosis would be heart damp stasis. Okay. So if it's heart damp or heart stasis, what formula would you use? 血附菊汤, Jeff, yep. Joyce, yes. 血附. Yes, you can use 天王补心丹. You can use 温胆汤. Lynn, yep. Noreen, yeah, I'll show you. I can show you. So yeah, so this is 血附菊汤, right? So if we wanted to, let me just free up some space here. Okay. Why is it not letting me free up space? Well, it's not letting me free up space. So I'm just gonna keep writing. All right. So we could just use 柴胡加龙骨母益汤. Actually, you can put all these formulas. You can put all of these three right here, these three right here, plus 血附菊汤, and that will be your formula to treat this patient's pulse. You would get all three. Okay. So the next objection that someone may ask me is, oh, is that too many formulas? No, it's not. This is what Feng Jia Feng is. You know, this is like a Taiwanese style, like I learned from Jimmy Chang. So, and they do this in Taiwan, where I was born. But they treat each formula like a single herb. So if we add these, it's really 1, 2, 3, 4, 5, 6, 7. It's really just 7 herbs, right? So this would be the formula. All these 3 right here, and then plus these 3 right here, and then this right here. That would be the formula for this pulse. And that's how I would treat. Okay. Now, someone had a question about the normal. That's why something happened there. This is what a normal pulse should be. So this is normal or home. A home. So this is regardless of left or right. They're both the same. The home for the Cun position is in the superficial. The home for the Guan position is in the middle. The home for the Chi is in the bottom. Okay, so this is superficial level. This is the middle. This is the bottom. Okay, so anything that is, if it's above its home, I'll give you a quick. No, this is my functional pulse diagnosis, and this is where it's different from Jimmy Chang's, where I simplify it. Anything that's above its home equals heat or excess. Anything that's below its home is what I said, damp or stasis. Okay, so this is called level. So to learn my functional pulse diagnosis, you only need two things, my FPD. You only need to know two things. One is level and one is strength. And that's it. Okay, level and strength. Just with these two things, I can diagnose a patient and treat a patient, prescribe the herbs, and get the results that I'm showing you. Okay. So strength, there's only two strengths. I draw it like an arrow like this. It means excess heat. And if I draw an arrow like this, it means deficiency. Okay, so if I drew an arrow like this, that means the level is correct. The level is actually at home, but I draw a down arrow, which means it's deficiency. So that means that's spleen deficiency. It could be spleen qi deficiency. Okay. If I draw an up arrow, let's say I have a pulse right here, and I draw an up arrow. So number one, the level is lower, is below its home. So when it's below its home, it means damp stasis. So I already know the first diagnosis is damp stasis. And let's say it's in the right side, okay? So I already know it's lung damp stasis. And then I see that it's an arrow above. Arrow above means excess heat. So therefore, the complete diagnosis is lung damp heat with some stasis. Okay? But I don't want to get too much into this because this is like, I could waste a lot of time doing this, okay? But that's just kind of an overview of my functional pulse diagnosis. Like pretty much that's it. That is it, okay? All right, let's move on. Oh, I haven't answered questions in a while, so let me answer some questions. Patients often fall asleep during the treatment. Have you seen any proclaiming better sleep after treatment to gauge your treatment efficacy? Yeah, it's a great question, Mario. I would say, probably the people that will tell me, oh, I can never fall asleep during the day. And then when they fall asleep during the acupuncture treatment, then that's a great sign. Katie Starr, you're welcome. Rebecca Calmer Bright, do you take pulse at each treatment or initial exam and re-exam? Great question. I only take the pulse if we're doing, there's two answers, Rebecca. The first answer is, if I'm only doing acupuncture and no herbs, then I will only feel their pulse at the initial exam and then 1 month later at the re-exam, okay? But if I'm doing herbs, I will feel their pulse once a week. The reason is I give them 1 week of herbs and then I feel their pulse to see the change. And based on what I feel the pulse, I change their herbs again, okay? I don't ever give the patient the same herbs week to week because their pulse always changes. It never stays the same, okay? Simon Bazati, how do you treat insomnia during menopause? Do you recommend bioidentical hormones? Great question. So insomnia during menopause is a hormonal thing, right? So I treat the hormone balance. So if in menopause, depending on what caused the menopause, well, actually, it really doesn't matter. Let me ask y'all, you can type this in the chat. What organ takes over producing sex hormones when women go into menopause? It doesn't matter what caused the menopause, but there's an organ that steps up to produce the sex hormones. Kidney. Can y'all be a little more specific? Dongfeng and Simon? Yeah, Noreen, you got it. Diana got it. Adrenals. So the adrenal glands are the only other organ in our bodies that can secrete sex hormones. So to answer your question, Simon, about insomnia during menopause, you have to get the adrenal glands to function better. So in TCM, what is that? That's the Chinese medicine, the Chinese medicine kidney. So yes, you were correct by saying kidney. So you get the adrenal glands to function better, and therefore you'll help them to sleep. I do not recommend I cannot. Okay, let me see if I can phrase this correctly. Bioidentical hormones are medications, so I cannot tell the patient whether to do it or not to do it. Okay, if they ask me, like, oh, I know you can't tell me because you're not a physician, but what would you do? So I would say, if it was my wife, I would not. And it depends. There's no clear-cut answer. If my wife still has all of her organs, then definitely I would never have her do bioidentical hormones. But if my wife did not have all of her organs, and I've done all of the Chinese medicine, the acupuncture, the herbs, supplements to help, and it's just not helping, then I may recommend my wife to do that. That's a little communication thing again. Sheila Kendro, how effective are these protocols if they are given once a week or twice a week or once a month in the initial phase? I don't practice 3 days a week. Will these protocols be helpful if they are given less frequent than 3 times a week? Sheila, great question. If it's for insomnia, it can still work because you can give them herbs. Okay, remember, I've treated insomnia with just herbs. So when I started off, they come in for the initial exam, I give them a week of herbs, and then I see them once a week. Okay, I see them once a week to feel their pulse and then change their herbs. And I still basically eliminate their insomnia. So for acupuncture, it's very difficult to do it just with acupuncture at once a week. But twice a week, it can work. And now I'm talking about if you weren't doing any supplements, you weren't doing any herbs, you were doing straight acupuncture, which I have done. Straight acupuncture by itself, acupuncture requires frequency, okay? Now, is my rule an absolute? Hell no. I know there's going to be acupuncturists saying, oh, I've done it before of one time a week. Yeah, it's possible. I'm sharing my experience. I don't know your experience, okay? But my protocol, if it's just acupuncture, So make sure I clarify this for you. If you're only doing acupuncture and doing nothing else, no other treatment, then you need that frequency. Okay. Now, and it also depends on the cause, because if it's a food sensitivity cause, you may not even need to do acupuncture. Just help them with their diet and you'll fix the problem, right? So you got to find the cause. Benjamin, what is home of kidney pulse on left and right? I think I answered that already. Anonymous attendee, how come you ain't putting your name again? Would you please show how you mix your formula? What machine do we need for it? How much do you charge? Can we give that medicine to patient without what's ingredients in? Do you make your own label? Yes, anonymous attendee, I can show you how I mix my formula. I would have to move my camera, so we'll do it later on, okay? I can answer your other questions though. What machine do we need? You just need a scale to weigh it, okay? That's it. You need a bottle for herbs. How much do you charge? I charge $5 a day for my herbs. So for those of y'all who were here yesterday, you've heard me say I do things differently. Every acupuncturist that I know, they charge by the gram, by the weight, right? I like to do things opposite. I don't charge by weight. I charge by the day. So $5 a day. And I charge low for my herbs, okay? I still make 100% profit off of them. So I ain't hurting on that end. So can we give that medicine to patient without what's being, I make my own label. I type it out, okay? You can write it out, but I have the exact ingredients of the herbs in the bottle. I've had patients from other acupuncturists and they show me their bottle and it doesn't tell them. It just tells them how to take it. That's not what I do, right? Again, I haven't seen, I think there was some type of law or something like that in the US about you have to label what's the ingredients inside. So I will label exactly what I give them and the dosage of what I give them, okay? Why is it heart stasis and damp as opposed to cold? Katie Starr. Oh, you're talking about when it's below the home? To determine if it's cold, we have to get into the shape of the pulse. I usually don't teach the shape of the pulse. Oh, I already answered it? Okay, never mind then. I won't elaborate even more. So would the formula be best in powder so you can combine it, or in capsule or tablet? Kim V, great question. Granule is always better because you customize it. See, I can change it, right? The capsule, I can't change. I just buy it from Evergreen and just give them it, right? But I can't customize it as much. I will tell you a little secret that some of you may be like, oh, you can't do that. Okay. I customize, those little black BBs, right? Those little T pills. I used to think they never worked, right? So I never carry them. And I have to actually, give credit where credit due. I learned this from another acupuncturist here in Texas, Carlos Chapa. I saw him combine these little black BBs. And so I started doing it, and it actually works. So you can actually almost customize these little black BB pills. So I do get a bottle, I remove it, and I dump it into my own bottle. So I'll dump each little BB bottle has 200 pills, right? T pills. So I will dump 4 different formulas into one bottle and just shake it, right? Obviously, I put a label on it and I tell them what's in it. But that way it works. And you can't, if you give 8 T pills 3 times a day, that ain't gonna work. I make them take 30 T pills 3 times a day, and it works. All right, Dana. So damps and stasis not considered excess. Excess is the damp and stasis is separate from excess. The damp stasis is just the level of the pulse. The excess part, it is excess. It can be considered excess. Answer your question. Yes, it can be excess. Kim V, is a stasis also cold too? It could be. It could be. All right, let me move on, okay? All right, so I gave you an example of the herbs. The diet, for those of y'all who weren't here yesterday, I'm gonna simplify your life. I do my whole diet based off the enzyme factor, a book called The Enzyme Factor, plus TCM dietary therapy that we learned in school. Okay, so read that. That should answer most of your questions. All right, supplements. So surprise, surprise, the supplements are the same too, right? Why is the supplements the same? Because I'm focused on organ function. I'm not focused on the label. I'm not focused on, oh, is it insomnia? Is it peripheral neuropathy? Is it Bell's palsy? I'm not focused on that. I'm focused on organ function. Let me change the color again. Someone didn't like red yesterday. So I focus on organ function. Okay, so calcium, I told you yesterday, calcium, magnesium, it can calm the nerves for trigeminal neuralgia, peripheral neuropathy, and it can calm the nerves for insomnia also, calm the brain, okay? Minerals have a sedative effect, sedating effect, right? Why do you think our herbs, longgu, muli, are so powerful? They probably have a lot of these two things in here. They're minerals, they're heavy, they sedate, okay? Fish oil, anti-inflammatory, and then professional formulas. This is a company, glandulars that I buy. So like if they like the patient that was asking about menopause, not patient, the acupuncturist that was asking about menopause and insomnia. So if their adrenal glands are not functioning great, I will give them an adrenal glandular. It is like eating an adrenal gland, okay? I don't know if they sell adrenal glands to eat, right? If it's a liver function problem, oh, I love liver. You can just tell them to eat liver. Some people actually will eat it, right? But if they don't, this professional formulas, this company will sell it. Okay, let me see. Hey, come on. Let's go. Hold on. It's not moving. Let me try this, see if it'll move. Double tap. There you go. Double tap works. Okay. So yesterday, if y'all missed it, I showed you how I guasa and I did it on my wife. So this is like for people who have pain that's causing the insomnia. We'll add the guasa and we'll add the rapid release therapy for the pain causing insomnia. Okay. So I already talked about that. Bam. Okay, so we'll go over this case, and I think we need a break, right? So we'll go over this, and then I will, then we'll take for a 10-minute break. So here's a case study, 50-year-old female, insomnia, 1 to 2 weeks before her menses, and she's had this for 10 years. When she first came to me, she looks tired all the time. I mean, no wonder, 10 years of insomnia. She can't stay asleep. She also gets migraines, okay? This was like a menstrual. This is like a combination of what we talked about yesterday. A menstrual migraine and a hormonal insomnia, okay? Hormonal, that's right, hormonal. Hormonal insomnia, okay? And so she tried prescription meds for sleep and migraines, and obviously it didn't work. That's why she came to my clinic. So her TCM diagnosis was heart damp, liver deficiency, heat, and lung damp. Now that's based off of my pulse diagnosis. I put this case because most a lot, when I was in school, I always thought, okay, internal disorders, it's always best to use herbs. Like herbs work better than acupuncture. for internal disorders. And so that's why I put this case, because I only did acupuncture on her. I didn't do any herbs at all. No herbs, no supplements, straight acupuncture. Okay. That's what I wanted to show you. It's possible. All right. So these are the points, roughly the area, not the points, but the area where I put the needles. I did bilateral, liver 3 to 8, spleen 6 to 9. On the right-hand side, I did large intestine 6, 12, blah, blah, blah. And I did, for her, I did ear acupuncture. I did ear, stomach, heart, liver, and intang. Okay. And I chose the right side on the arm. Well, I could have done both. I could have flipped it. So I did one right side on arm and left ear. Okay. I could have done right side arm, right ear. I could have done left arm, left ear. It doesn't matter. This is what you do, is you just try. I tried this combination, right arm, left ear, and it worked. Don't mess with what works. I've made this mistake multiple times. I'd be like, okay, it worked. Let me try something. Let me add something new, right? Mistake. If it works, leave it. Don't fix what ain't broken, okay? Because you will break it. So I treated her based on the protocol that I shared with y'all. And then now she comes in once every 3 months for tune-ups. Someone was asking me yesterday, that's, one of the things for some of y'all, for some people who have done like Richard Tan's balance method, one of the complaints that I've heard people say is that Richard Tan's balance method, or the balance method, or distal method, doesn't produce sustainable results. Like the results don't last. People say that, oh, you relieve the symptom fast, but it doesn't stick. And that's another reason why I showed this, right? And showed this case. So she right now has 0 insomnia, 0 migraines. She comes in once every 3 months to get a tune-up, okay? Like I said, it's all up to the patient. She wants to come every 3 months. She comes once every 3 months. If she wanted to come once a month, I would treat her once a month. But she has no migraines, and she's sleeping great, right? And it was straight acupuncture, no other change. I didn't give her a supplement. I didn't give her herbs. I didn't go over her diet. I just used acupuncture and fixed it. So I wanted to show you that it can be done. Okay. I think, yeah. Donna, are we ready for a break? Donna?
Yes, we are.
Okay. So
Sorry, my mic was off.
Okay.
So I did respond, but you didn't hear me.
Okay, let's go. What is it? You're at 10:47.
It's 10:47 here.
Let's go to 11.
Sure.
Okay, we'll be back at 11, guys.
Okay, Jimmy, whenever you're ready, go ahead and take over.
All right. Someone wanted to see my label, so I'll share that first. So this is my herb label. Can everybody see it? Yes, James home. Okay. Who asked me? Who's asking me? You can see my herb label. In young. I print it. So I print it into a label maker. I use Brother. I used to use Dymo label printer. Now I use Brother label printer. So I just print it. That's all it is. Okay. So you see my clinic contact info. what's in the herbs, the ingredients, the patient's name, the date, the dosage, what the herbs are supposed to do, the instructions on how to take it. This goes on every single bottle of herbs that we sell. Okay? Any questions on this? If not, I'm going to continue. No questions? Okay, good. Let me move on. How can I get out? Stop share. Share screen. Here, go to here, there. All right. Subspecialties. Let me make sure I open the chat. Okay. Let's start by answering some questions first, really quick, okay? If patient, Karen Boone, if patient is using sleep meds, including diphenhydramine, does that affect your results? It's more of the side effects of the medication. Acupuncture, what I like to explain with acupuncture is it actually enhances the effect of medications. May or may not be a good thing, right? But it can enhance it. Excuse me, most of the time it is a great thing. I do not ever tell a patient to stop their meds. Remember, I like to do things one at a time. So if they've been taking their medications prior to coming to see you, I just tell them to keep the same thing. Keep the same thing, just going to change one variable, and that's acupuncture. And then we'll see what happens when we just add one variable, okay? If, let's say that I would like them to stop their medications, you got to be careful, at least in Texas, we can't tell people what to do with their meds. I would tell them, hey, can you go talk to your physician and see if you can get off med? That's how I would say it, okay? Rose Sum. If you're treating a bilateral condition and either one side of the arm are affecting both sides of the condition, yes, one arm can affect both sides of the condition. You have the ipsilateral, you have the contralateral, right? What is BB pills? BB pills are T pills. You haven't seen T pills? You can just Google it. T pills. Kalab Jarash. How do you formulate for autoimmune pulse with strength deep and not clear side? Strongest at deep level. What do you mean? How do I formulate? It depends on if it's a strength, it's deep and it's strong. Deep means damp stasis. Strong, I'm assuming what you're saying is like it's stronger than normal. It's like then it's heat, excess. So there's damp heat with blood stasis. So I would put herbs in to lift the pulse. Okay. So let me clarify. Even though I gave you all of those definitions of how I do the pulse, but how I treat the pulse. So I think Kalab, this is what you're saying. It's below its home, it's deep, and it's strong. Okay. So step one, you want to clear the excess. Which is this right here, okay? Step two, you want to raise the pulse. Okay? So to clear this excess, you clear heat, cool herbs, drain dampness, right? To lift the pulse, we talked about this yesterday. To lift the pulse, you can either tonify or invigorate. Invigorate blood or chi. Invigorate. I think I'm spelling that wrong. Obviously, because it's excess, I would not choose tonify. I would just move the blood, move chi and blood, move chi and blood to lift the pulse, Okay. Jeanette Morris, wouldn't you recommend more DHA than EPA for sleep? Yes, I would. Yeah. If you want to get really technical, yes, DHA is going to be more for the brain. EPA is more for the extremities, like peripheral nerves. So yes, good point. Club asked again, Donna, oh, that's a Donna thing. Mario, do you ever use Anmian? No, I would say rarely. Because remember, my patients, they're laying in a recliner. So I don't want to stick a needle like right here in the neck, like right here, Anmian, right? And then they turn their head and pushes the needle deeper, okay? Or bends the needle or breaks the needle, right? So that's why I don't put it back there. Joyce Sonata, do you do the same point, area, location protocol for all 6 visits if it works on day 1? Hell yeah. Don't fix what ain't broken, okay? I would even, whatever you did works, I mean, I'm joking here, but maybe get a permanent marker and then just circle those areas. So every time the patient comes in, tell them don't wash that area, okay? Because I want to stick a point right there every single time because I know it works, okay? But you get my point. All right. Mary Beth Jones, what herbal label software do you use? It's just Microsoft Word. If you just go through Microsoft Word, if you just buy the label printer, they'll tell you what's the label size, and then you can just go through Microsoft Word, and they have templates that match it, okay? Celia Raya, who is the author of Enzyme Factor? Google it. Simon Bazara, do you recommend 5-hydroxy? Is that 5-HTP? I believe that's what you're saying. I don't because I don't need to, because the acupuncture and the herbs work great. I rarely, like the 3 supplements that I showed you, those are really the ones that I really go with, because herbs and acupuncture are so powerful, so effective. You really don't need much. Remember, I don't like to throw the kitchen sink. I am like, use the least possible, right? Use the least possible to get the result, if that makes sense. Ira Soper, take herbs with food, especially tonic herbs. Yeah, so this is going to be different from what we were taught in school, right? Yesterday, someone asked, if there's a yin deficient constitution, a person who has a weak constitution, supposedly, theoretically, that if you stick a lot of needles, it makes it worse. I have never had that experience. I always stick 30, 40 needles, doesn't matter what their constitution. It still works. And so it's for this one, when to take the herbs, is it better on an empty stomach before, if it's a different type of herbs, like you're saying, tonic herbs? Here's the thing. I tell my patients, ideally, I want them to take the herbs on an empty stomach, okay? However, what's more important is that they take the herbs. I would rather them take the herbs consistently than have to worry about the timing. So what I tell my patients is, I don't care when you take it, just take it. But if you want to know ideal time, on an empty stomach, either before your meals or in between. Usually it's before meals, okay? Yim Nung. If patient cannot get 2 to 3 times per week, can self-acupressure with your system help? Ooh, that's a great question. I haven't tried that yet. It should. It should. ARM. This might not be related to topic, but I appreciate if you cover drug detox herbs or herbs used for withdrawal effect. Yeah, let's try to stay on topic, okay? I can answer that question, just email me. Vicky Chung, how should you treat torso tremors upon waking? We're not to tremors yet, but I can say restless leg syndrome. So if it's torso, I can tell you right now, Vicky, if it's torso tremors upon waking, where's the torso? The torso is right here, right? Torso right here. See, draw a line. Where does it go? Right here to right here. Throw needles all around here. Start with one side and just do this on the legs too. Okay, both legs, bilateral. That's how you treat it. Image, very simple. Focal dystonia, we're not there yet, but I will get to it. Oh, this was probably earlier on. Sorry, Vicky. Okay. I'm going to dismiss the ones that I answered so I know that I've answered them already. Okay, guys. Okay. Okay, so let's move on. Thank you, Jeff. Yes, I am very confident, and patients can feel it. And that's actually a great topic. I just spend 1 minute on this, okay? Part of, my success in producing results and also building, my practice is based on what Jeff just mentioned. So confidence, especially when you're starting out, it's hard to have confidence because you don't produce the result, right? But let me teach you a little twist. There's a difference between confidence and certainty, okay? Does anybody know the difference between confidence and certainty? There's a difference. Who knows what's the difference between confidence and certainty? Anybody know? Egotism? Confidence is earned. Experience? One is you believe, one is truth. Oh, great. Yeah, great points. So here's my, take on confidence and certainty. Confidence is knowing what you know. Certainty is confidence plus knowing what you don't know. Okay? So this is my take on confidence and certainty, and this is what I teach all of my team members, because we don't all have 20 years under our belt, and you don't need 20 years under your belt to have certainty. Okay, certainty, and I have noticed patients respond better to certainty versus confidence. Confidence is only knowing what you know, and that could take time to accumulate, right? I mean, it's like someone said, not scratch that. Confidence is like it can be interpreted as ego, someone egotism, right? Someone is like egotistic, like a big ego. It can be interpreted that way, confidence, right? Certainty is you know what you know, but you also, more importantly, know what you don't know. So I like to exude certainty. Some people think I am cocky. Some people think I have a big ass ego. I own it. But for myself, mentally, I like to be more certain. I know what I don't know. That's why I can make fun of myself. That's why I can, I know that I've made a lot of mistakes, that I'm not the best. It's knowing that I don't know everything, but being comfortable with it. Being comfortable with knowing that you don't know everything. It's okay. A lot of times my patients will ask me something like, y'all ask me some questions that I don't know. I have no problem saying I don't know. I don't know everything. And so It's having that certainty in yourself. Patients respond better to that than someone that thinks they know everything all the time, right? So just a little side. Hopefully that was a little nugget for you. All right, let's move on. Movement disorders. Okay. We are essential tremors. I think this was Vicky's question. So we're going to talk about essential tremors and dystonia. Okay. Let me see. Hold on one second. Let me see if I have a video. Where do I have a video? Essential tremors, MS. Essential tremors. Okay, I have more videos on this one. Okay. So what is an essential tremor? A nervous system disorder that causes involuntary and rhythmic shaking. It can affect almost any part of the body, but trembling occurs most often in your hands, head, voice, especially when you do simple tasks such as drinking from a glass or tying shoelaces. Okay, so that's the definition of an essential tremor. Now, remember what I said yesterday. Does that really matter? Because essential tremor and dystonia, the presentation sometimes is very similar. So do we need to be neurological specialists to be able to differentiate what is an essential tremor versus dystonia? The answer is no, because the treatment is exactly the same. Remember, those questions I ask you, does differentiating essential tremors from dystonia change the way you're going to treat the patient? If it doesn't, then why are you worried about it? Okay. And plus, we, at least in Texas, we cannot diagnose a patient. We cannot say, oh, hey, you got essential tremors. Okay. You have to be a medical doctor in order to label a patient. All right. Typical causes of essential tremors that I treat. Okay. One is idiopathic and genetic mutation. So initial exam process, guess what? It's the same thing. Okay. You determine the potential root cause. Okay. So this part is really, okay, we don't know what the hell caused it. It's a root cause and possible genetic mutation. There's only two causes. Okay. So determine the root cause. So usually is we don't know what the hell caused it. You just have it. Okay. Congratulations. You won the lottery. Determine organ dysfunctions. Okay. That's the key. This is the key. It doesn't matter what they label. They are labeled. It's based on organ dysfunction. Eliminate possibilities. It does matter if there's a genetic component. Okay. Diagnosis is my functional pulse diagnosis. Blood labs. Okay. Imaging of the brain and cervical spine. Okay. I video the patient holding a cup or like an eating motion, and we use thermography to monitor progress. Okay. So the prognosis is improvement of ADLs. Does everybody know what ADL stands for? Does everybody know what ADL stands for? Who does not know what ADL stand for? Okay. Yep, Rebecca just wrote it. Activities of daily living. This, when you go to so the Western medicine is all based off of ADLs. Their whole treatment focus is to get the patient, which is a good focus too, is to get the patient back to doing their activities of daily living. Now you can Google it. Dr. Google will tell you exactly what that means. But it's stuff like being able to groom yourself, being able to brush your teeth, hygiene, being able to dress yourself, being able to tie your shoelaces, right? Being able to walk to the bathroom to poop, okay? So these are all ADLs. So what is the number one ADL, or what is the number one life effect? So what is the number one life effect for someone who has essential tremors? I kind of mentioned this on Wednesday, but who knows? What's the life effect of a patient with essential tremors? Yep, Karen got it. And to really be a little more specific, it's not just eating problems. I mean, eating problems, yes. Mylene, being able to eat socially, that is the key. Because when they're at home and they're flicking food, and it's not getting into their mouth, it doesn't bother them as much. It's weird. I mean, it's kind of weird. It's like they don't really care about that at home, but they care about it when they're out socially. They would rather not be able, I mean, it's just like what bothers them more is the being embarrassed versus being able to put food in their mouth. But that's what it is. Okay. Yeah, isolation. It's more embarrassment. People are more embarrassed than actually eating, right? But eating is definitely one of them, right? So if we can decrease the tremors by 50%, or what I would say, if they can be able to put food into their mouth, okay, then that is a great success. Okay, they can do that. Okay, let's see. Let me just scroll through something really quick. Tremors, dystonia. Okay. Okay, so treatment protocol. So the treatment protocol is 6 treatments. 6 treatments within 14 days, okay? For those of y'all who are scared to ask the patients to come in 3 times a week, number one, if you were not here yesterday, you missed out a lot yesterday. I mean, you're getting a lot of gold nuggets today that I didn't do yesterday. But both days have gold nuggets. But yesterday's gold nuggets, I actually went over the script on how to get patients to logically, through logic, tell the patients to come 3 times a week for the first 2 weeks. Okay. So you definitely, if you didn't buy yesterday's webinar, you need to go buy it. You can use that script for every single patient in your clinic forever. I've used it for, I created it probably 10 years ago, and I've used it and I haven't changed it because it still works. But off topic. 6 treatments, 3 times a week for 2 weeks. The results expected is to decrease the number of the intensity of the tremors, right? So this is the reason why I would highly recommend you videotape them. Hold on, let me get a little cushion for my tushy. My little stool is getting hard on my buns. Okay. So you want to videotape a patient, doing these activities, okay? That way, and then when you're re-examining them, or after you do these initial 6 treatments, if it's not very obvious to the patient that they're improving, then on the 6th treatment, I will videotape them again. Basically having them go like, hold a glass. Let's just say, I'll just have them hold, not this big, okay, but just a glass of water, okay, because they'll be going like this. So I would videotape them holding a glass of water. I would videotape them, just get a pencil and like a utensil and go like this, see if it can make it to their mouth, okay. Some of the patients wear glasses. I'll have them take their glasses off and take their glasses off and put the glasses back on. Okay, I will videotape them before and after the 6 treatments. Okay, so after the 6 treatments, if it's not significantly noticeable to the patient, I would videotape them and then play both videos. Okay, and because if you see the improvement and they don't see it, they need to visually see it. Okay, you seeing it doesn't really matter. Okay, it's them seeing it. But if you use my QRA acupuncture, which is super simple, you will see improvement. Actually, you will see what I do is I have them hold a little anything, just have them hold whatever, hold something, and you'll see their hand tremor like this, okay? And then put it down, and then use my QRA. We're gonna go over the points. Don't worry, hold on to your panties, okay? We're gonna go over the points and just put in the points, and then have them hold it up again, and you'll start to see the tremors start to get less, okay? Instant, baby, instant, okay? All right. Results, decrease in tremor, intensity, duration, frequency, monthly treatments, okay? Depending on the improvement after the 6 treatments, if you see, if they were tremoring like this in the beginning, and then they're like this now, then I would do twice a week for 4 weeks. But if they were tremoring like this, they're tremoring really bad like this, and then they're still tremoring pretty bad, I would do 3 times a week for 4 weeks, okay? But again, I want to see 50% improvement in their ADLs. All right. Bam, acupuncture. Okay, let me answer some questions again, okay? Practical would not be, let's see, patient takes meds. Yim Ning. If the patient takes meds, would you have them space 1 hour in between the herbs and med? I don't. I just tell them first take your meds and then take the herbs afterwards. Okay. Simon Bazati, would not be more practical to use 5-HTP or melatonin or bioidenticals instead of glandulars? That's a great question. That's going back to insomnia, so let me address that, okay? Because that's actually a very important question. So glandulars are just like food. The glandulars, the 5-HTP, the melatonin, the bioidentical hormones, those supplements, I mean, glandulars are a supplement too, but let's just say the 5, I talked about this yesterday. Melatonin. Well, let me ask you this. Simon, let me ask you this. Do you want the reason you're giving a supplement, is it to replace a function in the body, or is it to restore a function in the body? Okay? So that's the difference. This is what I think about. Do I want to replace a function versus restore? Okay. Simon, you want to do both? Okay. Then if you want to do both, then you can do the 5-HTP, melatonin, and bioidentical hormones instead of the glandulars. Yeah. So you kind of answered your question. Okay. So let me tell you what I do. I do not, if it's possible, I never want to replace a function in the body. If it's possible, I always want to restore. If it's possible, my number one go-to is restoring function in the body. Because if we want to replace a function in the body, patients don't need to come to us. They can just go get medication. It's cheaper. Their insurance covers it. They have a copay, like lisinopril, like blood pressure, or let's say insomnia. They can take Ambien, Lunesta. They can take what else? Trazodone, right? And many Americans do. They replace a function. They don't need to come see us. If their goal is to replace a function, why are they coming to us? The power of Chinese medicine is we have that Western medicine does not have, is we have the power and the ability to restore function. That is the beauty of Chinese medicine, okay? Functional medicine. Yeah, functional medicine, I talked about this yesterday. Functional medicine replaces function too. Because you think about it, melatonin. Melatonin is a hormone. produced by the pineal gland, or I don't know how some people say it, pineal gland. Our bodies naturally produce melatonin. Functional medicine supplements melatonin. So it's the same thing as bioidentical hormones. It's the same thing as thyroid hormones, right? Again, I'm not saying what's right or wrong. I'm just saying these are the facts. They replace a function. So if you constantly give your patients melatonin, you're constantly doing hormone replacement therapy. That's what HRT stands for, right? Hormone. You see, they even admit it. The Western medicine even admits it. Hormone replacement therapy. Melatonin is an HRT because melatonin is a hormone. And if you're giving melatonin to the patient, you're just giving the body a hormone replacement therapy. So what does that do? That makes your pineal gland lazy. Your pineal gland be like, oh man, you're doing all the work for me? Cool. I don't need to do any more work then. I'm just going to be chilling, I'm going to be on my sofa, drinking a beer, watching TV. I don't need to work out anymore. I don't need to work anymore. And so over the years, your body stops producing melatonin. Okay? Chinese medicine, what Chinese medicine does is it goes in and it says, oh, Mr. Pineal Gland, you ain't doing your job. So I'm about to whip you, okay? So I'm about to do something to get your butt off the couch. I'm gonna get your butt off the couch so that you can start doing your job, okay? But at the same time, I'm gonna feed you, okay? I'm gonna love you with some discipline. I'm gonna love you with some food. So I'm gonna give you some food. I'm gonna feed you, okay? But then I'm gonna discipline you. I'm gonna retrain you through the nervous system. I'm gonna tell you, Mr. Pineal Gland, okay, I love you. I'm gonna give you some food. Get off your ass. Let's get to work, okay? Hopefully that makes sense. All right, so let's go back to essential tremors. You're welcome. Where are we? No magical points, okay? I typically use around 30 to 40 needles, okay? So let's look at, I have some point selections here. But let's just look at it. Where do most people get tremors? For those of y'all who treat tremors, where do most people get their tremors? Hands. Yep. Exactly. Extremities. Exactly. And essential tremors usually is just one-sided. Okay. So if they're tremoring in their hand, this is like, what does this remind you of? What we talked about yesterday, right? Head also, yes. Mm-hmm. What did we talk about yesterday, right? If you have, what's the problem we talked about yesterday in the hands? Y'all should already know the treatment. What did we talk about yesterday in the hands? That happens in the hands. Neuropathy, yes, exactly, Jeff, Alexis. So if it's in the hand, if it's in the right hand, this is the right side, you choose the left foot. And you just basically put 10 needles in the left foot, okay? You put it all over the foot. You put it all over the ankle. And then you have them hold. Remember, so you put 5 needles in the foot. I would use the ba. Okay, on the feet is ba feng, I think, right? I think on the feet is ba feng. So the ba feng points. Bam, 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 bam. 4 needles. Okay, hold the water and see if the tremoring starts to calm down. If it doesn't, then I would go around the ankle, right? What is that? Liver 4, liver 5, stomach. What stomach is that? 41, bladder 40, gallbladder. I don't know what gallbladder point. Anyway, somewhere around the gallbladder and the ankle. See, I don't use points anymore, so I don't remember them. Just go around the ankle. You could be kidney also. Do 5 needles around the ankle, and then have them hold the water again. See if the tremors stops or minimizes. If it doesn't, then you did one foot, right? You did the opposite. Remember, the tremor is in the right hand. So you start off with the left foot. So if you did the left foot and it didn't reduce it, then you go to the right foot and repeat the same thing. You go ba feng, okay, or you mean liver 3 in that area, and then you have them hold the water again. Hold the water, see if it shakes. And then you do the ankle, see if it shakes, right? So I would do like 5 needles on the left foot, 5 needles on the left ankle. That's 10 needles. And then that didn't work, 5 needles on the right foot, 5 needles on the right ankle. And if that didn't work, that's 20 needles, right? So usually the next step that I'll go is either the left hand or the head. So if we go to the head, we look at the hand is tremoring, right? So we put the hand on top of the head, hand on top of the small head, right? So the fingers in the hand, so I would put like on the hairline, 5 needles, 5 needles on the hairline, okay? And then ask them to hold the water. And usually one of these is already working. I'm just going down through, I'm letting you know all the possibilities that I would do if it didn't work. Usually in the feet, it instantly works, okay? So if the front, I'll do 5 needles in the front and the hairline. If that didn't work, I'll do 5 needles along the, around do 20 lateral, okay? So like do 20 is right here, I'll just go lateral, okay? And see if that works. So that's 10, 20, 30 needles. So after 30 needles, the tremoring is still the same. Okay. Now I'm not looking for the tremoring to stop completely. I'm looking for the tremor to go like this, to go like this, to go like this, to very mild. Okay. If you get this mild tremoring after the first foot, you're good to go. You're golden. Okay. But let's say you don't. We did both feet, we did the head, the scalp, and it's still tremoring like crazy. Well, then we're going to go to the left hand. Okay, left hand, we're going to do the ba xie, right? So the ba xie, that's 4 needles about right there, and then ask them to hold the water again. If that didn't work, then we'll go like liver 4, large intestine 4 or 5, sanjiao 4, small intestine 4 or 5, that area. Okay, and then have them do the water again. Okay, so that's 10, 20, 30, 40 needles. If after those 40 needles and you're still not seeing any improvement in the shaking, they may be a delayed responder, which means they won't see the results until later. Their immune system may be so inflamed, so much retention of toxins that it takes a while for it to work. Okay, but like I said, majority of the time, it's rare that I have to go through all these progressions for it to work. One of these progressions will work. Okay, again, let me repeat. It does not mean they will just suddenly stop tremoring. It means they go from this to this, right? So it's good to have a water bottle, not this big a water bottle, but it's good to have a water bottle. So you can see the water shake, okay? But it doesn't have to be. It can be anything. It could be a phone. It could be like this, okay? They'll shake like this and then suddenly go like this. See, if they go like this, from this, that's already success, okay? All right. Any questions about that? Let me share my screen again so I can see people. Let's see. Let's go back to the slides first. Okay. So you can see I go, these points right here, I do go up also to the, that's another imaging. I mean, there's so many imaging. I just went through the basic imaging. Let's just say, okay, the right hand is the one that's tremoring, okay? The right hand is the one that's tremoring, and I did the left foot, like I just told you, the ba, feng, and the ankles, and it worked. Then I would just use that leg. I would go spleen 6 to spleen 9, kidney 7 to kidney 10, liver 5 to liver 8. I would plaster that leg because I know that leg worked. I know the nerves in that in the left leg directly influenced the tremors in the right arm, right hand. So I would just plaster. Once you find an area that works, just put like at least 5 more needles in that area. Okay. All right. Let's see. And that's the technique down here. That's what I just went through. All right, let me answer some questions. Okay, Ira, you need to go into the chat, not the Q&A, to ask Donna. Min Wen, how do you treat tremor of the head? Same way. The head, hand. If the head's tremoring, what I just told you to do with the foot, you can use the foot because the foot images the head. If you imagine the foot is the head, the ankle is the neck, and the knee is near the belly button, right? So the head is the foot, so just stick needles on the head. So you could treat head and hand tremor by sticking needles in the foot, okay? Arm, are you having them sign a consent form for videotaping? No. I just say, hey, I'm going to videotape you. Is that okay? And they give me a verbal yes on tape. I have them verbally on video telling me it's okay to me to videotape them. I think that's better than having them sign something. Is it best not to needle at the tremor area? Kelly Rose. What if it's tremors throughout the body? You had said not to needle where neuropathy is, as it can exacerbate things. Is this the same for tremors? Great question, Kelly. I don't needle at the site of any problem for the first 3 to 6 treatments. I stay away because I want to make sure I do no harm. Okay. So I don't think I've ever needled somebody in the area that they're tremoring. But if they're tremoring throughout the whole body, I haven't had a patient that tremors through the whole body. The tremors that I've seen are mostly in the hands, arms, legs, and head. Okay. If it's the whole body, I would still stick with the feet and the hands. Well, but I would say, Kelly, look at what's worse. Where is the tremor the worst? And stay away from that area. Okay. Katie Joy Star, will you repeat the 2 areas on the foot? Okay. Yes, I will. Let me go back to this. So the first area on the foot is the ba feng, which is in between the toes. Okay. So you have 5 toes, right? And then so there's 4 areas in between. So that's 4 needles right there. So it's in between the toes. And then you can put one on spleen. What is that? Is that spleen 2? Spleen 2 or spleen 3? Okay. Spleen 2 or spleen 3 right there. So it's in between the toes and then spleen 2. So that's 5 needles. So I would put 5 needles right there and then ask them to hold to see if they're tremoring. If that doesn't work, then I'll go to the liver 4, stomach, spleen 5, stomach 41, bladder 40, kidney 6, kidney 3, bladder, is that really bladder 40? It says, oh, it's gallbladder 40. Sorry, I've been saying the wrong thing. Sorry, guys. I don't know my points. And this, the G was rubbed off of her ankle. Bladder 60, gallbladder 40. Okay, there's an extra point there too. But it doesn't matter the point, guys. The point is just around the ankle. So just do it around the ankle. So those are the 2 sets of points that I would do. Okay. Min Wen, tremor of the lips. Ooh, I haven't had that. Tremor of the lips. So the lips are right here, right? The lips are right here. So they're below, the lips are right here. They're below the nose. So if we know the arm is where the nose is at, below the nose, the lips will be around the wrist. So then I would do points like large intestine 5, 6, 7, sanjiao 5 to 7, lung 7 to 6, maybe some PC if you have access to it. I would start there. Or I would go into the ankle or spleen 6, liver 5 area. Okay. Yim Ning. You do all these while they are in recliner? Yep. Yes, I do. Dr. Drew Pearson, do you use a Tremor app on their phones? A Tremor app on their phones. Oh, I didn't know that existed. That's pretty cool. Can you email me? I mean, if you use it, can you email me? I think that'd be pretty cool. Does it measure like the vibration when they hold their phone? I didn't even think about that. Oh, that'd be a great idea. Drew Pearson, please email me about that. Oh, hey, Grant. Sorry about radio. What needles do you use most? So if I'm doing needles on the feet, I typically use half inch, 32 gauge DBC Spring 10. Okay. I only use, I would say 99% of my patients, I use 1 inch, 32 gauge DBC Spring 10 everywhere. All right, would you please repeat the hand points? The hand points are, let me use this hand. So it's instead of ba feng, they're ba xie. So ba xie is in between. Oh, I can use my own hand. I don't know why I'm looking at using hers. Okay, got a bigger hand here. So ba right here, bam, bam, bam. Small intestine, right there. Large intestine, 3, I think. Right there. That's 1, 2, 3, 4, 5. 5 needles, and then watch their hand. Oops, watch their hand and see if it tremors. Okay. If that doesn't work, then I go large intestine 5. Is that 5? 5 or 6? 5. Yeah, 5. Sanjiao 4. Small intestine 5 or 6. Actually, I would just go here, 1, 2, 3, 4, 5. 5 needles there, and then I would have them hold their hand, see if it tremors. Okay, so those are the 2 hand points that I use. You're welcome, Katie. All right, Mary Beth Jones, what if a patient has a visceral tremor? I had a patient that had quaking or tremor sensation in their abdomen that would occasionally radiate to the ribs up to the gallbladder nerve. Lots of Western diagnostics, and I was not able to resolve it. Ooh, that's a great question. I mean, I would treat it the same way. If you still have access to that patient, if that patient's not coming to you, call them back. Call them back and tell them, hey, I just learned something new and I want to try it on you. Get your butt back here so I can do it on you. Okay, I'm pretty sure they'll come back. And basically, if it's in the gallbladder area, so the gallbladder area is right around here, right? So you just draw a line, and you're almost like the elbow area, and just throw needles. Throw about 5 needles here, okay, above and below the elbow, and do the same thing with the knee. You'll be around the liver 8 area, spleen 9 area. Do 5 needles around there, and see if that helps. Let me know, okay? Why wouldn't you choose hand points? I did choose hand points. Drew, it measures vibration. Yeah, please email me. I would like that. I can have my tremor patients using it. Okay, let me move on, okay? Oh, okay. Let me see if I can move on. Yeah, let me move on and then I'll answer some more. So herbs. So the question will be herbs. Can herbs help? Yes, they can. Again, I will share with you, I've treated tremors with straight acupuncture by itself, and it's effective. And I've done acupuncture plus herbs, and it works. I have not done just herbs for essential tremors. So I don't know if it can work without acupuncture. But I know essential tremors, we can help them with just acupuncture. Okay. So no magical herbs. Again, same thing, guys. Nothing new, right? Remember, one system. Isn't this beautiful to have just one system and you can treat everything? I mean, if you can really open your mind and really accept this concept that there is a possibility you can just have one treatment system and you can treat every disorder. You're focusing on the root. We talk about focusing on the root cause all the time, but are we really focusing on the root cause, right? And so that's why I was thinking, before I developed all this, I was like, man, there's got to be a way. Chinese medicine focus on the root. The root is causing all of these symptoms: tremors, insomnia, Bell's palsy, peripheral neuropathy. These are just symptoms. They're not roots cause. There's a root cause. And if we can fix the root cause, all these symptoms will either go away or get better, right? So hopefully this benefits y'all. Okay. So reality is you treat the pulse. Common herbs and formulas. Someone wrote that I didn't write. I use herbs that's not in these lists. Let me tell you the reason why. Okay, if I were to write every single herb that I used for tremors, I would just basically hand you John and Tina Chen's formula book and say, look, all of these formulas work. Why? Like I mentioned here, all herbs work. It's not the herbs, it's the diagnosis. Okay. So, but let's go through some common. Let's say you don't have, let's say you're not so good at the pulse yet. Even though if you did my functional pulse diagnosis, it's just like, all you need to know is level, feel the level, and feel the strength, and you got it. That's it. But let's give you an example. So let's say you don't know how to feel pulse, and what two organ systems. So let's talk about what organ system do you think about when we say tremors? Like which organ is dysfunctioning when we see tremors? What are you thinking about? Someone type in. What do you think? Liver. Yep. Liver because of wind, right? Yeah, liver and kidney, right? So liver. Tremors means there's wind. That's what tremors mean. There's wind in the body. It's just a matter of what's causing the wind. But a lot of times it's the liver dysfunction that's causing the liver wind, right? Others can cause wind too, but liver is the most one. So look at all of these formulas down here. Which one of them does not address the liver? Did I make my point? Does everybody understand what I'm trying to say? Yeah, all of them address the liver, right? Okay, if I had a mic, I'd be dropping it. I don't want to drop my pencil though, okay? So every one of these, that's why I put them here. When in doubt, if you think that you're not good in herbs, you think that you're not good in the pulse diagnosis, any of these formulas, you can put all of these formulas into one formula and give it to the patient. Okay? All right. So dietary, I already went over this yesterday, and I went over it this morning, so we're not going to go over that. Supplements. Guess what? It's the same supplements, right? Something that's going to calm The nerves, calcium, magnesium, fish oil, alpha lipoic acid, vitamin D, all anti-inflammatories. Decrease inflammation off the nerves, okay? I don't use that many different types of supplements for neurological conditions because, like I said, acupuncture is probably the primary tool that I use for neurological conditions because it works so fast, okay? All right, other modalities, same thing, gua sha, rapid release therapy. So why would I want a gua sha for essential tremors? Who knows? Type in the chat. Why would I want to do gua sha or manual therapy on someone? To move blood? Yes. To vent wind? Yes. Why else? What's the side effect of tremors? Yes, Dongfeng, to relax the muscle. Stiffness. Yes, they could get pain and exhaustion. Yeah, tension. I mean, if you've never had a tremor, I challenge you to go like this every day. Just keep doing it every day, okay? Keep doing it. And what's going to happen is your arm gets stiff, your shoulder starts getting stiff, your neck gets stiff, and that starts pinching on nerves in your neck. You want to relax all of this. You want your nerves to calm their butt down. You want to relax, okay? That's the reason why we do the additional. I would say 100%. Yeah, I can't think of any of my tremor patients I've ever had that did not have stiffness in their muscles and tendons and ligaments, okay? Oh, I didn't differentiate this. I just thought about this. The essential tremors versus like Parkinson's. So essential tremors, here's a big differentiation. Does it really matter? No, it doesn't. But I'm going to tell you anyways. So essential tremors, who knows? Actually, who knows? Let me ask you. I kind of just browsed over it. What's the difference between essential tremors versus Parkinson's? Does anybody know? Difference between essential tremors and Parkinson's. How can you tell? Just a label for MD. Exactly. Yes, Simon. Resting tremors. So essential tremors are tremors when they're moving, they're eating, right? Parkinson's is at rest. You're not moving your hand and it's tremoring. Okay? Essential tremors is when you're not moving your hand. When you're not moving your hand, it's not tremoring. But then when you go pick up something to eat, that's when you start tremoring. Okay? And today I'm going to show you either here. I think I'm going to show you here. I think it's this example. I had a patient who had both. She came in for essential tremors and just got diagnosed with Parkinson's. So she tremors at rest and with movement. That's what I'm saying. It's just a label, right? So it's like the treatment's the same, but it's just, that was wacky. Oh, that's the one that I'm talking about right now. Okay, so let's go over it. So, let me answer some questions first, okay? What about Leonard Hicks? What about twitching eyelids? Just, that's not necessarily, it is a tremor. But yeah, eye twitches, yeah, just treat it. Where's the eyes? Image the eyes. The elbows are the eyes, and your knees are the eyes. Just stick needles around there. Guarantee you it'll stop twitching. Mik Yong Lee. How long do you retain needles? 30 minutes. Let me go through that. Nadine. Oh, Nadine, thank you for writing the Google review and the Yelp review. Thank you for doing that. I appreciate that. Do you use the rapid release on tremor patients, arm to neck, or both? For both that and gua sha? Yes. So I will do the rapid release mostly on the neck and shoulders to relax the muscle and also to break up any scar tissue that may also be impinging nerves to cause the tremor. Okay. And I do gua sha the arm. I usually just gua sha the neck and shoulders. I don't necessarily gua sha the hand, but you can. Okay. Vicky, Vicky, I already told about the torso tremors. I think I answered that already. Focal dystonia. What you kind of already know about focal dystonia, you just treat the feet. Okay. All right. All right, let's move on. Let's go to this case study. So this was the one I was talking about. She came in for essential tremor in the right hand. Okay. And let me just present this first. And then just July, like last week, she was diagnosed with Parkinson's. No imaging. Okay. Treatments she tried before she came to me was muscle relaxers, antidepressants, levodopa. Actually, all the medications, what she noticed was they made her tremors worse. The levodopa, like dopamine, the medication for dopamine, made her tremors worse. At rest, her Parkinsonism tremors and essential tremors. It's supposed to make it better, but it made it worse. So she stopped all the medications because she was getting worse. The treatment at our clinic, so we did acupuncture mostly, and then we added a little e-stem here and there. Okay. You can see the acupuncture points were exactly what I just told you. The Ba Feng, liver 3 to 8. I mean, you can read all this, Ba Xie, right? Basically, what I just went through, that's what I did. The acupuncture points series 2, it's the same points on the right side of the body. See, I did on the left side first, and then I switched to the right side. Now, why did I switch to the right side? Because we kind of plateaued. We plateaued so that I wanted to do something different. Okay, so I'll keep with the same treatment until until I see a plateau, or no, mainly until I see a plateau. Once I see a plateau, I'll change up the treatment. Okay, so we hit a couple of plateaus. That's why I did e-stem also. I did e-stem on right arm, left arm, and scalp. Okay, and what I found was the e-stem really didn't do shit. So we don't do e-stem anymore. Okay. All right. Let me show you before, I think, see. Oh no, we still got an hour. Okay, so I can show you the videos. Let me pull up my videos. Which one is her? Okay, this is pretty cool. Let me lower all this, clean up my here. This one was recent. This one. Okay. Why does it say my movie? Hold on one second. I'm going to pull up the video of this patient. Let me make sure. Okay. Move this. Move this. Move this. Move this. Okay, here we go. Let me share my screen to the chat so I know. Can y'all all see this? There should be 2 videos on the screen. Can you see it? Yes. Okay. So we'll play the first one. This is December of last year, 2019. Okay. This is the first one. Watch your hand. You see how she was shaking like crazy? There's just a little water in there, okay? I didn't put it full, otherwise she'd spill it. This was January of this year. It seems like you can control it better. You can.
That's
really
what I feel sometimes, yeah.
Yeah, you can actually shut it down. Don't you hold the heavier cup? Okay, hold on. Let me make sure. Hold on one second. Make sure it cut off her head. Oh, I just want to make sure her head wasn't in the video, but you can see. Hold the chat. Ooh, we're gonna chat. Okay, so did y'all see the difference, right? That's what you got to do to show the patient. I mean, the patient will know also, but you can see the drastic difference between before and then, yeah. So that was December. That's only 1 month of treatments. So 1 month of treatments, it changed drastically. She's a patient also that I said that she likes to sew and knit. So I tell her to, to thread a needle every single day. So I tell her to thread a needle. For those of y'all who sew, you know how hard that is, right? To put a thread through a needle. Imagine you have essential tremors trying to put a thread through the needle, right? But she can do it every single day. So she still has her tremors. I didn't eliminate 100%, but now she can go out and eat, right? Right now we're dealing with just making sure it doesn't. Remember, part one is to get her to her life effect, which is being able to eat, being able to. She loves to sew. She can still sew. Okay, being able to do her life effect, and that's the number one goal. So we got her to her goal. Then the second part of my treatment phase, remember, is to make sure it doesn't come back, right? So we are in July. So that was in January. Her tremors are still the same like they are in January. Like she's just barely tremoring, okay? So that's what happens when you use my systems. You can get that result. You can get it because I'm not the only person that treated her. My associates treated her too. My associates, the ones I use, the one that treated her, that's with me right now, he just graduated from acupuncture school. Like, I think December. He just started with me 3 months ago, and he's doing this. Okay. Oh, okay, Donna. We need a break. So let's come back. We are at 12:10. Let's come back at 12. 5 minutes is good? Okay. Then 12:15. All right. I see y'all in 12:15.